Female genital system. Important information. Lining of ovary is called germinal epithelium, but it is a misnomer. Oocytes in the ovary are not derived from germinal epithelium. Oocytes are derived from primordial germ cells. PGCs are derived from epiblast cells. Just before ovulation, the primary oocyte converts into secondary oocyte. Zona pellucida is a glycoprotein membrane formed by two sources surrounding granulosa cells, the oocyte itself. Functions of granulosa cells. They help in forming zona pellucida. They produce estrogen with the help of theca cells. Preantral follicles, primordial and primary follicles, antral follicles, secondary and Graafian follicles. Fallopian tube or uterine tube. Layers of fallopian tube from outside to inside. Serosa. It has connective tissue lined by peritoneum. Then muscularis layer. It has smooth muscles. They help in peristalsis of fallopian tube, which pushes the conceptus towards the uterus for implantation. Mucosa. It has two types of cells, ciliated columnar cells and nutritive cells. Ciliated columnar cells helps in pushing the conceptus towards the uterus. These cells have basal nucleus. Nutritive cells or PEG cells do not have cilia. They have microvilli. PEG cells provide nutrition to conceptus. The nucleus of these cells is protruding towards the luminal side. Uterus, cervix and vagina. Epithelial lining of various structures. Uterus and endocervix lined by simple columnar epithelium. Ectocervix and vagina lined by non-keratinized stratified squamous epithelium. Squamo-columnar junction. It is seen at the junction of ectocervix and endocervix. Grossly, it is seen inside the cervical canal in the beginning. When the female is capable of bearing babies, the squamo-columnar junction moves outside towards the vagina. The epithelial lining of endocervix changes from columnar epithelium to stratified squamous epithelium when it comes outwards. This occurs due to acidic pH of vagina. This is called physiological metaplasia. This continues throughout the reproductive age. Once the females achieve menopause, the endocervix and squamo-columnar junction move inwards again. Females who are predisposed to carcinoma cervix must be monitored regularly to make sure that physiological metaplasia is not changing into dysplasia or cancer. Osteology. Two types of ossifications are seen. Membranous ossification. The bone forms in some mesenchyme membrane. It is seen in facial skeleton, skull cap, mandible and clavicle. Endochondral ossification. The bone develops from the hyaline cartilage. It is seen in bones of upper limbs and lower limbs, vertebra and ribs. The femur bone develops by endochondral ossification. Primary center of ossification. It appears at 6 to 8 weeks of intrauterine life. It contributes to shaft diaphysis of the bone. Secondary center of ossification. It appears at the birth of baby, that is, after intrauterine life. It forms the multiple epiphyses of the bone or ends of the bone. Growth plate. It is made up of hyaline cartilage. It is present at the ends of diaphysis. As the child grows, the hyaline cartilage keep on getting replaced by the bone. This bone is called metaphysis. Adult bone. The peripheral part is quite dense and is called compact bone. The interior spongy part, which also has bone marrow, is called spongy bone or trabeculated bone. Components of spongy bone. Some bone trabeculae are bone spicules interdigitating with each other and with lot of air spaces between them. Type 1 collagen, osteoblasts, involved in bone formation.